Hello, class. Welcome to Flourish Nursing Academy. This is Tutor Godwin. We'll be talking about the lymphatic system. The lymphatic system is part of the circulatory system and an important part of the immune system, comprising a network of lymphatic vessels that carry a clear fluid called lymph, from the Latin lympha, meaning water, directionally towards the heart. The lymph. The interstitial fluid picked up by lymphatic capillaries is known as lymph. Lymph very closely resembles the plasma found in the veins. It is a mixture of about 90% water and 10% solutes, such as proteins, cellular waste products, dissolved gases, and hormones. Lymph may also contain bacterial cells that are picked up from diseased tissues and the white blood cells that fight these pathogens. In late-stage cancer patients, lymph often contains cancerous cells that have metastasized from tumors and may form new tumors within the lymphatic system. Composition of lymph. The composition of lymph is similar to that of plasma, but the constituents have some additional substances that are too large to pass through blood capillary walls. X macroparticles from damaged areas and cells damaged by disease and bacteria. Lymph vessels. These originate as blind-end tubes in the interstitial spaces. Structurally, they are the same as blood capillaries. Their walls are more permeable to all interstitial fluid, including proteins and cell debris. The capillaries join to form larger lymph vessels. Lymph vessels have numerous cup-shaped valves that prevent backflow of movements of lymph in vessels. Lymph vessels join together to form two larger ducts. I, the thoracic duct, Sutter T, the right lymphatic duct. The lymph vessels, I, the thoracic duct. What is a duct? A duct is a circumscribed channel leading from an organ. Its length is 40 centimeters, ascends through the diaphragm, and passes upwards in the thoracic cavity. It drains lymph from A, both legs B, the pelvic abdominal cavities, C, left half of the thorax, the left upper limbs, limbs mean hands, upper limbs, and legs, lower limbs. D, the right lymphatic duct. It lies in the root of the neck and opens into the right subclavian vein. It drains lymph from a right half of thorax, means chest, thoracic cavity. B, neck C, right upper limb, lymph nodes. A normal young adult body contains some 450 B, arms and superficial thorax, 40 C, legs and superficial buttocks, 30 D thorax, 100 E abdomen and pelvis, 230. A small oval or bean-shaped body ranges from 10 to 20 millimeters in diameter. Positioned along the course of the lymph vessel, a slight depression called hilus, blood vessels enter and leave through it. Microscopic structure of the lymph nodes. A fibrous capsule encloses each lymph node. It consists of the capsule, cortex, and medulla. Fibrous septa, or trabeculae, extend from the covering center of the node. Cortical nodule packed with lymphocytes surrounded by a less dense area, the germinal center. Cortical nodules within the cortex are separated from each other by trabeculae. Medulla is composed of sinuses and medullary cords. Cell zones in lymph nodes. Zone 1 is a region of loosely packed cells, predominantly small lymphocytes, macrophages, and occasional plasma cells. Zone 2 is a denser region internal to Zone 1, composed mainly of small lymphocytes and macrophages. Zone 3 comprises the germinal centers of follicles. Its cells include largely lymphoblasts, dendritic cells, and macrophages. Functions of lymph nodes. 1. Defense. As lymph passes through the lymph node, reticuloendothelial remove microorganisms and other injurious particles. 2. Hematopoiesis, site for the final stage of maturation of lymphocytes and monocytes. Monocytes are a type of leukocyte, or white blood cell. They are the largest type of leukocyte and can differentiate into macrophages and myeloid lineage dendrites that have migrated from phagocytic action. 3. Activate T and B lymphocytes. 4. Filtration of lymph, lymphatic tissue, or lymphoid organ. I. Tonsils. Small masses of lymphoid tissue around the pharynx. Trap and remove bacteria and other foreign materials. Tonsillitis is caused by infection with bacteria. Ti. Spleen. The spleen is formed partly by the lymphatic system. Location: the left hypochondriac region. Length: 12 centimeters. Width: 7 centimeters. Thick: 2.5 centimeters. Shape: oval. Relations: posteriorly and superiorly. Diaphragm inferiorly, left colic flexure of the large intestine, anteriorly fundus of the stomach. Structure of spleen: reddish, brown organ, looks like a loose fist, enclosed in peritoneum, covered by a capsule. The trabeculae subdivide the structure into lobules. The spleen has no afferent lymphatic vessels. It has only an efferent lymphatic vessel. The spleen consists of red and white pulp. Splenic artery, splenic vein, lymphatic vessels. Functions of the spleen: phagocytosis of bacteria, breakdown of red blood cells, production of antibodies. Bone marrow. The red bone marrow is a key element of the lymphatic system. The thymus is one of the primary lymphoid organs that generates lymphocytes from immature hematopoietic progenitor cells. The bone marrow and thymus constitute the primary lymphoid tissues involved in the production and early selection of lymphocytes. Furthermore, bone marrow performs a valve-like function to prevent the backflow of lymphatic fluid in the lymphatic system. IV. Thymus gland weight: 15 grams. Relations: anteriorly sternum, posteriorly aortic arch, superiorly root of neck, inferiorly heart, laterally lungs, lobes. 2. Each lobule has an aggregation of lymphocytes. The cortex is composed of an aggregation of lymphocytes. The medulla contains fewer lymphocytes. The thymus gland develops mature T lymphocytes. Blood supply to the thymus gland. Inferior thyroid artery, internal thoracic artery, nerves derived from the vagus nerve. Functions include activation of T lymphocytes, production of antibodies, production of thymosin hormone. Thymosins are small proteins present in many animal tissues. They are named thymosins because they were originally isolated from the thymus. Peyer's patches, tonsils of the intestine. Found in the wall of the small intestine, it captures and destroys bacteria in the intestine. Lymphatic nodules. A group of lymphocytes arranged in a round cluster is called a lymphatic nodule. Many organs contain lymphatic nodules. They contribute to defense against microorganisms entering the body. The lymphatic nodules cannot filter lymph. Location: in the walls of the alimentary canal. Tonsils, appendix, meshwork of reticular cells. Composition: the germinal center region contains a large outer ring of small lymphocytes. Mucosa-associated lymphatic tissue. MALT. It is the diffuse system of small concentrations of lymphoid tissue found in the mucosa of various organs of our body, e.g., lungs and the gastrointestinal tract. It regulates mucosal immunity. T cells, B cells, plasma cells, and macrophages populate it. It contains a light-staining region in the center, germinal center, and a dark-staining region at the periphery. Stimulation of its B lymphocytes leads the virus to the epithelium, thus blocking the entry of these microorganisms to the subepithelial layers of the intestine. 2. BALT, bronchus-associated lymphoid tissue. 3. NALT, nose-associated lymphoid tissue. 4. LALT, larynx-associated lymphoid tissue. 5. CALT, conjunctiva-associated lymphoid tissue. Lymphatic disease. Lymphatic disease is a class of disorders that directly affects the components of the lymphatic system. Diseases and disorders. Hodgkin's disease, Hodgkin's lymphoma. This is a type of cancer of the lymphatic system. It can start almost anywhere in the body. It is believed to be caused by HIV, Epstein-Barr syndrome, age, and family history. Symptoms include weight loss, fever and swollen lymph nodes, night sweats, itchy skin, fatigue, chest pain, coughing, or trouble swallowing. Non-Hodgkin lymphoma. Lymphoma is usually a cancer. It is caused by the body producing too many abnormal white blood cells. It is not the same as Hodgkin's disease. Symptoms usually include painless, enlarged lymph node or nodes in the neck, weakness, fever, weight loss, and anemia. Lymphadenitis is an infection of the lymph nodes usually caused by a virus, bacteria, or fungi. Symptoms include redness or swelling around the lymph node. Lymphangitis. Lymphangitis is an inflammation of the lymph vessels. Symptoms usually include swelling, redness, warmth, pain, or red streaking around the affected area. Lymphedema. Lymphedema is the chronic pooling of lymph fluid in the tissue. It usually starts in the feet or lower legs. It's also a side effect of some surgical procedures. Lymphocytosis. Lymphocytosis is a high lymphocyte count.